How to diagnose ankylosing spondylitis? Ankylosing spondylitis can be tough to diagnose for several reasons. Its symptoms, like back pain and fatigue, are similar to those of many other conditions. It tends to affect young people who aren't likely to suspect they have type of arthritis. It may be harder for doctors to diagnose women with ankylosing spondylitis, which is 5 times more common in men. Women often have different symptoms than men too. They may first notice pain in their necks rather than their backs. Also, there is no single test for ankylosing spondylitis. Your doctor must rely on other methods to diagnose your condition. If your primary doctor suspects you have ankylosing spondylitis, they might refer you to a rheumatologist. This doctor specializes in diagnosis and treating inflammatory diseases like ankylosing spondylitis. Physical exam. The doctor you see for your diagnosis will usually start with a physical exam. They may ask you to bend in different directions to see how well you move and where you have pain. They might push on parts of your body, move your legs around, or ask you to take deep breaths. Your doctor will also ask you about when your pain began, how long it usually lasts, what time of day it tends to happen, whether it gets better with exercise, if you have a family history of ankylosing spondylitis, any other symptoms you may have. Imaging tests. Your doctor may do the imaging tests like an X-ray or MRI. An X-ray helps your doctor see changes in your bones and joints, but if your ankylosing spondylitis is in its early stages, this test may not pick up signs yet. An MRI can capture a better picture for your bones and soft tissues. It can help your doctor find signs of ankylosing spondylitis more easily, but it's a lot more expensive than an X-ray. Blood tests. Your doctor might test your blood for the gene HLA-B27. Many people with ankylosing spondylitis have the gene, but not everyone who has it gets the condition. Your doctor may also check your blood for signs of inflammation, which could be caused by ankylosing spondylitis. A high erythrocyte sedimentation rate (ESR) and a C-reactive protein (CRP) can signal inflammation. But not everyone with ankylosing spondylitis have these blood markers, and they could result from other conditions like anemia or infection. Diagnosis. Because imaging and blood tests often fail to identify early symptoms, ankylosing spondylitis can sometimes take years to confirm. Your doctor can usually make a diagnosis if an imaging test finds issues related to ankylosing spondylitis, and if you have at least one of these signs. Reduce the ability to move. Your lower back. When you brace, your chest doesn't expand as much as doctors would expect for someone for your age and sex. 3 or more months of lower back pain that gets better when you move around. If an imaging test doesn't show signs of ankylosing spondylitis, but you have all 3 of these symptoms, your doctor may diagnose you with probable ankylosing spondylitis.